Manitoba is declaring a public health emergency over an increase in HIV rates.
HIV rates in Manitoba have sharply risen over the last number of years.
Chief Provincial Public Health Officer Brent Roussin says the province continues to experience some of the highest rates in the country. The rate from 2024 was 3.5 times higher compared to other provinces. He says in 2025, there were 328 new cases in the province, contrasting 142 in 2021. The majority of cases are in Winnipeg, and the Indigenous population is disproportionately affected. Roussin says other factors driving infection rates are injection drug use, homelessness, and a rise in other sexually transmitted and blood-borne infections, as well as barriers to access to care.
These are really complex issues. These require much more than simply a public health response. Our focus is going to be on reducing new infections, improving access to care, supporting people living with HIV, and addressing the conditions that continue to drive transmission within Manitoba. So this emergency, it's not about creating fear. It's about acknowledging the reality that individuals and communities are facing right now, and to address that with a level of urgency.
Roussin says the province will be ramping up measures such as strengthening harm reduction services, expanding access to testing and prevention, and improving access to care.
And so our goal here is to ensure that every person in Manitoba, regardless of where they are, regardless of their background or their circumstances, can access the care and support they need.